Using the toilet is a very intimate and private task that we perform on a daily basis multiple times. And having bladder and bowel accidents can decrease our quality of life due to the breakdown of our skin, infections, if we're not cleaned, if we don't clean ourselves in a timely manner, digestion, constipation issues. This can also lead to mental health issues such as anxiety, depression, social isolation. You might not want to go hang out with your friends or go out if you're having issues with going to the bathroom. Using a bedside commode can help restore independence quickly and effectively. And it doesn't have to be a forever thing that you always use the commode. This could be temporary if you're just recovering from injury or surgery or an infection. As an OT, I would recommend using a bedside commode if there are bladder and bowel issues. Say the person has limited control or they need to respond to the urge more quickly, immediately, and you want to make sure that they continue to be independent. I would recommend a bedside commode so they can continue to have that independence in that very private and intimate task. Also, if they have limited functional mobility, if they are not able to transfer themselves with or without assistance from the bed to the chair, or not able to walk to the bathroom due to the distance, they're not strong enough to walk to the bathroom, I would recommend a bedside commode, because even if someone was helping them, then it would be much easier for someone to transfer them from the bed to a bedside commode versus transferring them by using a walker, or if they have to carry them to the bathroom. That's not safe for them to do. So I would recommend using a bedside commode. Again, safety concerns. If the person, let's say they're not strong and they're pretty weak, and it takes a lot of effort and energy for them to walk to the bathroom, or they might fall. It's dangerous for them. The bathroom can be considered one of the most dangerous rooms due to the environment layout. Some bathrooms are not equipped for us to bring a walker or a wheelchair in there. So sometimes people, in order to stay independent, they perform risky behaviors, such as maybe holding onto the wall or the sink, and all of those things are not safe. Also, the floor is very slippery, so they might slip and fall. So in order to prevent those things, I would recommend a bedside commode, because it'd be easier for them to transfer from their bed to the commode and continue to be as independent as possible. And like I said, and also I would recommend the bedside commode in order for them to gain independence in the task. So they don't have to ask someone for help in order to do it, because sometimes you don't want to ask for help. You want to be able to do these very private and intimate tasks by yourself. So this will help them gain that independence in the task, at least as much as possible. Obviously, every situation is different depending on the person's strengths and abilities, but this will help them gain that independence. You can conduct a Google search on standardized bedside commodes, and as you can see, there are various different prices, options, different layouts for the commodes. They can get pretty pricey. There's some that are over $100. The cheapest one that I have found is actually from Walmart. It's $33.79 plus the shipping. But you can definitely purchase one online, but the one I'm going to show you, it's about $12 to make yourself. So it is a savings. In my field work, since I was at a hospital, I was not able to actually give a patient my bedside commode that I created, but I did have a patient in mind when I created it, and it was a 68-year-old male who had hip replacement surgery, and he actually sustained this surgery because he was trying to go to the bathroom by himself. So he didn't have any bladder issues, but he wasn't able to walk to the bathroom safely due to the distance and the layout of the bathroom. He actually had to not use his walker in the bathroom because of the layout, and that is how he fell. So sometimes bedside commodes are not always covered by insurance companies and can be costly. So like I said, the one that I'm about to show you, I made for $12. Also, you can adapt this to the client's needs by maybe purchasing a bigger chair, a shorter chair, a taller chair, pipe insulation. It could be thicker or thinner. I also had the idea maybe you can use like one of those inexpensive like pool noodles if you want something more cushiony or more thicker. You can definitely use that, but all the items that you see here for this bedside commode were purchased at Home Depot. So this is the list of materials and equipment needed to build this bedside commode. You needed a plastic lawn chair, a bucket, which a bucket, if you have one, that's great. What I actually did when I was at Lowe's is that I actually put the bucket under the chair because I wanted it as close as possible to the rim of the chair. So it just makes it cleaner. There's no splash or anything like that. The pipe insulation, I picked something pretty thin. A saw or a drill. I actually purchased a hand saw, but you can definitely do this with an electrical saw. You need scissors, and you need Gorilla Glue to glue the insulation on the actual seat. Now the directions to make this. You can draw a square on the plastic chair. I didn't. I just looked at the bottom of it and I kind of figured it out. But I did drill a hole in the center, as you can see in my picture. And what I did is I started drilling small holes close together and then use the hand saw to cut through the hole. But if you had an electric saw, this could be much quicker and much easier for you to cut that hole out. Then what I proceeded to do is use the pipe insulation to line the inside of the edges of the cutout. So I lined it and then I began to cut it. So just be careful, because if you cut too much, it's going to be too short and then you're going to have to place several pieces together, and it's just better just one whole piece. And then what I did is use the Gorilla Glue on top to first secure the top portion, and I placed my books on top, since they're very heavy books, for about 2 hours to secure the piping. After that, I turned the chair upside down and I used the glue to secure the bottom of the pipe. And I put the Gorilla Glue. Again, I put the books on top. You want the books on there so it'll be a close, tight, snug gluing. Otherwise, it's not going to glue properly and it's just going to start to fall apart. Then I just lined the bucket with the trash bag and I placed it under the chair. Since this was the first time I was building a bedside commode, it did take me about 30 minutes to cut the holes. But if I had an electric saw, and if I had built it a couple times, it would probably much easier. But this is definitely something that you can construct within 30 minutes, minus the drying time, and you can have a bedside commode for full use in less than 5 hours, which is much quicker than if you were to order it online and then get it shipped. It's going to take a couple of days, if not a week, to obtain your commode. So this is much easier, much quicker. This is a demonstration of how to use a bedside commode. To clean the commode, you can definitely use a Clorox wipes, which I believe would be the easiest, or you can use disinfectant spray and a paper towel and just throw it all in the trash bag and throw out the trash. we can definitely do that in order to keep it clean at all times. These are my references, and this concludes the presentation. Thank you for watching.